Okay, so now what I'm going to do is show you how to wrap a bowl. On the last wrap, when I wrapped the mosquito forceps, always make sure you put a sterile indicator in there, which I forgot. So while the video was paused, I went ahead and rewrapped my item and put it in there. And it's fine to do that as long as you do it before you get over to the autoclave. So now for doing a bowl, which is one of the more complicated instruments or pieces that I will give to students, they always like to see a demonstration of that. So again, what you're going to do is you have the item, which is a bowl, and you're going to select a wrap that is of appropriate size for this bowl. These two wraps are what I'm going to select for this bowl. So I'm going to show you how one is a little bit bigger than the other. So I'm going to use, again, the smaller one on the inside and the larger one on the outside. I'm going to put them in front of me in a diamond shape. Procedure is exactly the same for cloth as it is for paper. It must be double wrapped. And we're going to start with our item right there in the exact center. I'm going to bring it down just a little bit. And now, here's where I forgot last time, I'm going to take a sterile indicator. The pouches have those little arrows we talked about as sterile indicators. The wraps do not. The autoclave tape, again, has just been exposed to heat, not been exposed to steam sterilization. These sterile indicators have a little note on there that say, you know, gas check is going to say red when it's not been exposed to steam sterilization, and it will turn brown when it has been exposed to steam sterilization. So I'm going to take that, and that's going to be my proof that this became sterilized. Where do I put this? I put it in the centermost, the innermost area of the object. So in this case, I'm going to put it right in the middle of my bowl. If I was wrapping 4x4 gauze, which I'll do in a little bit, I would put it in the center of the pile. Not on top, not underneath, but in the center, because that's the innermost area, right? If I was wrapping this tissue forceps, I would lay it down on the paper, on the cloth or paper, and then just wrap around it, because you can't get any more innermost on metal, okay? All right, so I have my bowl, I have my cloth in diamond shape, my bowl just below center, and I'm going to do the same procedure. Now see how here I have a much smaller, I don't have to go back and forth with that fan fold, but you always have to have at least one fan fold flap, okay? That's for opening. So I got to kind of hold it a little bit, right? I don't want to push it down. I can push it down in there, but that's a little bit difficult. So I'm going to kind of hold it here at the top. I'm going to tuck in this side because it's got more depth to it than the last item that I wrapped. I'm going to kind of tuck in this side and then bring this over. And again, I want to kind of come straight up on my item and make another fan fold. Let me give that one a second one. Tuck in the other side and bring it straight up and over. And fan fold back. Okay, so now I have my first wrap done. So again, my flap is kind of here on the side. So I could do either way. I could set it this way, but it might get caught. I don't know if it'll stay this way. So now it's fine to wrap upside down. The first time you wrap a bowl, it has to be bowl side up. Everybody with me on that? I think I'm going to go ahead and leave this flap down here. There's enough of it there. And again, the inner wrap does not have to be taped, so not in the very center, just below center. Okay, he's not wanting to stay, so we're going to leave him like this. Just below center, up, fan fold, tuck, bring it over, straight up. Now, these wraps, they have to cover this whole center. If this wrap was too short, let's say for instance, this was all the farther it would cover. See how this inner area is not covered? It's got to, they have to overlap each other a little bit, okay? Let me straighten my stuff back out here. Get my fan fold, because we've got to make sure that's always there. Bring this over, straight up. Fan fold for my right side. Tuck in, fan fold for my left side. Wrinkle there. Okay, so now my bowl is wrapped, double wrapped. Now you notice you have a little extra on the corners because it's round and the wrap is rectangular or square, right? That's okay. But if you have a whole lot on this side, see how I don't have a whole lot of floppy on this side? I got a little bit on this side. It's because it started to go out a little bit where I warned you to come straight up, okay? But that's good enough for this competency. It's just a little bit on the one side. And we're going to take tape. And again, tape it the appropriate way across. And I'm going to put the date 11, 9, 15, my initials, Dana Woods, because I'm the one that wrapped it. And I'm going to label it small bowl with proper spelling. And now it's ready for the autoclave. Set it aside. All right, let's wrap 4x4 gauze. So again, I'm going to find some wraps that are of appropriate size, using the bigger wrap on the outside and the smaller wrap on the inside. Procedure again is the same in the middle, just below the middle. I'm going to grab a sterile indicator, put it in the innermost area, which is in the middle of the gauze, okay? And then start my wrapping technique. Now see how I'm going to use this straight edge? Because I want to come up. So you don't want to wrap your gauze in a diamond shape, make sense? So that you have a nice flat edge to come to. Not the center, but just a little below the center. Do my second wrap. Label it. Gauze. Again, all spelled properly in my permanent pen. And then lastly, I do want to go ahead and wrap a metal instrument for you with the wraps, okay? So I'm going to use this tissue forceps. Oh no, actually this isn't last. I'm going to do one more after this. So I can use this much smaller wrap because this is a small instrument. So again, I have my tissue forceps. I'm going to need a sterile indicator. And again, I don't want to wrap it this way because see, when I come up to do this first one, how that's really kind of difficult. So I want to wrap it long way. So center, just below center is where I'm going to pull up. And now this will be a good example of how sometimes these won't meet. So see how I don't want to do it like this? See how I have this middle opening? Okay, and I want these side flaps to overlap at least a little bit. And I can do that with this. One instance might be if you only have this much and they're still not meeting, that much of a flap and they're still not meeting, you need a bigger wrap. Okay, but in this particular case, let me get this guy back up there. I can do that much of a wrap on this side and I can overlap this one and still have a decent amount of that flap folded back. Everybody see what I mean by that? Okay, and then again, and so sometimes you have to kind of hold kind of a place for that to roll up because some of this, on the one end of this, it's real narrow. So I kind of have to pull the whole thing up so it's not going at an angle like this. Does that make sense? Especially with those ring handles, a lot of times. You have to kind of compensate on the other side to keep it nice and even. All right, so this is my, again, tissue forceps, not right in the center, just below center. Technique is always the same. Some good timing. You guys will be great Christmas present wrappers. All your Christmas presents are going to look awesome. Better than Santa's. Okay, and then I'm going to label. And I'm going to label it again with the date, my initials, and tissue forceps, and set aside for sterilization. All right, the final thing that I'm going to show you, I promise, is going to be how to wrap a sterile drape. Does somebody mind grab me another one of these green things from over there? I'm one short. I thought I had them correct. Now, we will wrap sterile drapes for our skin prep and possibly other procedures. So a sterile drape is nothing more than one of these muslin drapes, thank you very much, that we will use to cover a sterile field, okay? So when you do that, you need to fold your sterile drape in a certain fashion. When you fold it, you need to make sure that it's folded in a way to where you have a corner very accessible to the outer area, okay? So when I fold this, I don't want to fold it like this, because see how I don't have one of those exposed corners out? They're all folded edges. Does that make sense? Do you see the difference? So I need an exposed corner out, because when I take this, if you already watched the skin prep competency, you have to touch that exposed corner and pull it up, okay? So you have to have that exposed corner where you can unfold the entire drape. Bigger one. And then we're going to wrap it in a manner to where when I unfold this, that corner is going to be out. So I'm going to always unwrap this away from me first, so I need that corner away from me when I wrap it. If I wrap it with that exposed corner towards me, when I unwrap this, that corner is going to be in here and I'm not going to have access to it. Does that make sense? Okay? So I'm going to wrap it with that exposed corner out, because ultimately when I unwrap it, now that corner is out here and I can grab it and it's not tucked in down by my hands. Okay, so same with like the 4x4 gauze. I need to put a sterile indicator in here, but I want to put it in the innermost area, which is in the center of that sterile wrap. Okay, or sterile drape, I should say. All right, so again, diamond shape. I'm going to come up here. And you'll notice, especially on this one, not all of these wraps are square. They're kind of rectangle. So see how I don't have near the same amount on this side as I did the other side? And that's totally okay. It's not all nice and pretty. I don't have a nice even ending wrap, but again, that doesn't really matter. Use my larger one for the outer wrap. Again, diamond shape. Not in the exact center, just below center, and then my process, once again, will be towards me, the flap towards me first with a fold back, either side, right or left side, maintaining straight up with a fold back, and then away from me, coming towards me last, and then labeling. And I'm going to label, once again, the same way I did for my others, which is going to be date. And I'm going to write sterile drape on this one with my initials. Okay, so 11, 9, 15, DW, sterile drape. Okay, so now we're going to pause the video and I'll show you how to use the autoclave.